Hi, my name is Dr Tasha and I'm a breast cancer surgeon. Welcome to the channel. In this video, I'm going to be talking about the differences between a lumpectomy and a mastectomy in the context of breast cancer surgery. Let's get started. If you have been diagnosed with breast cancer, it is likely that surgery has been recommended as part of your treatment. You might have been recommended to either have a lumpectomy or a mastectomy. And there are different reasons as to why you might have been recommended to have one operation over the other. And in this video, I'll be going through those differences. A lumpectomy essentially means removal of the lump, and in this case, it's the cancer. It may also be referred to as a wide local excision or breast conservation surgery. Lumpectomies are usually suitable if the cancer is relatively small in comparison to the size of the breast. And at the time of the operation, the cancer is removed and the defect that is left by the cancer will be filled by moving around the surrounding breast tissue, so you won't get an obvious defect. Sometimes breast cancers do not present as lumps and are instead picked up through either an ultrasound scan or a mammogram. And if the size is still quite small, we can still do a wide local excision or a lumpectomy, but of course there isn't really a lump as such because it was picked up on a scan. Because we can't feel the cancer, that cancer will need to be localized with either a wire or a magnetic seed, which are usually placed before the surgery. And at the time of the operation, of course, the wire and the seed will be removed together with the cancer. A mastectomy, on the other hand, is removal of the entire breast, including the nipple areola complex. And the scar will run across the chest, which will of course be flat after the operation. And there are a few reasons why you might have been recommended to have a mastectomy. If the cancer is large in comparison to the size of your breast, if there are more than one cancer in the same breast and they are quite far apart from each other. If you have inflammatory breast cancer, then you'll be recommended to have a mastectomy. If you carry the BRCA1 or BRCA2 gene mutation or any of the other high-risk genes, and you have a high risk of developing breast cancer in the future, then a mastectomy may be recommended for you. And also, of course, patient's choice. So if you have opted out to have a mastectomy, then of course we can do that for you. In the UK, if you choose to have a reconstruction, that is building a new breast after a mastectomy, we can either do this at the same time as the operation, the cancer operation that is, or as a delayed. And if you want me to talk about reconstruction in more detail, let me know in the comment section below and I might do a video on that as well. Both lumpectomies and mastectomies can be done as a day case, so you come in on the day, it's done under general anesthetic, and you can go home on the same day. There are of course other treatments that might be required following surgery. You might need radiotherapy or chemotherapy. We can say that after a lumpectomy, as long as you have a breast, radiotherapy is usually recommended, and that is to minimize the risk of cancer coming back within the breast. If you have a mastectomy, the need for radiotherapy is reduced, but it can't be guaranteed that you won't need it, and that really does depend on the final outcome of the operation. Likewise for chemotherapy. The other thing to mention as well is just because you have a mastectomy doesn't mean that you cannot get a recurrence. The recurrence, of course, doesn't happen within the breast because, of course, the breast is no longer there. But when we do a mastectomy, about 5 to 10% of breast tissue is actually left behind because we can't remove 100% of breast tissue. And so there is always a risk of the cancer coming back, and that normally happens within the flap or the skin overlying the chest wall, and that's something that needs to be considered. So I hope this has been helpful. Do consider subscribing if you would like to learn more about breast cancer and health, and I'll see you in the next video. Take care.